Okay, so welcome to our May Child Outcomes Accountability Team meeting. We're really excited to bring folks together today. And we have a couple of goals, and I'll go over the agenda in a moment. But first, if folks could just do intros in the chat, since we're a bigger group this morning, that would be really helpful. Kind of name and affiliation and role would be great. Um, but this is our May meeting for the COAT team. It is one of 7 of our Vermont Early Childhood Action Plan committees, and it is charged with monitoring the first goal of the VCAP, which is that all children have a healthy start. So, as those of you who are kind of regular members of this group know, some of our we kind of focus on social determinants of health and that intersection of health and developmental well-being, and some of kind of the social determinants of those things. So recently we focused on things like home visiting. We had a great meeting recently about housing. And most recently our March meeting was related to substance use disorder and bringing together some state folks who spoke to the kind of resources available statewide to support families navigating substance use disorders, as well as some of the kind of regional strategies to support families and young children. Good morning, Brina. So we are excited today to focus on first, we're going to have Jen Fortman, who's joined us, do a little preview for everyone of, not a preview at this point, she's going to do a brief version of the Family Needs Assessment briefing that we held last week, and many of you joined that, so it'll be a little bit of a repeat, but we're going to focus kind of on one of the policy considerations that came out of that work related to families' ability to learn about and find or access resources and services within the early childhood system in Vermont. So Jen will kind of kick us off with that. And then we're going to learn more from South Carolina's director of First Five South Carolina, who's joined us and is gracious with her time this morning to join us and tell us a little bit more about their one-stop early childhood service portal and kind of give us a sense of how that works. And then we'll have a conversation about their work and opportunities to improve our own system in Vermont, specifically related to quality improvement under PDG. So those are kind of our goals this morning. Jen, are you in a good place to kick us off? I'm happy to share the slides too. Let me know what's most useful on your end.
Yeah, I'm in a good spot. And sure, why don't you share your screen? That would be helpful. Thanks.
Of course.
So hello, everyone. I know a lot of you on here, but for those who don't know me, my name is Jen Fortman. I am the co-chair of the Families and Communities Committee. It's one of BBF's VCAP committees. I sit on this committee as a parent representative, and I am the parent lead for one of the VIP or the VIP3 grant through HRSA, which I'll talk a little bit about in this shortened presentation. So for those who saw and attended the Family Needs Assessment, thank you, and sorry for the repeat of information, but we're excited that this is out and we can have these conversations with you all. So just finding the slide I'm talking about. So the creation of the Family Needs Assessment was 2022 Family Needs Assessment. It was led by myself and the other co-chair, Sarah Morrison of the Families and Communities Committee, along with the members of that committee, and supported by the State Advisory Council and you all and other organizations from the early childhood system. The work was funded by this VIP3 grant I just mentioned. So HRSA is the Health Resources and Services Administration through the Vermont Integration Prenatal to Age 3 grant. It's a 5-year grant ending in July of 2026 and is led by the Vermont Department of Health Family and Child Health Division and partnering with BBF to support building upon and strengthening system integration, family leadership work, and an equity lens within Vermont's early childhood system. It was designed through the spring and summer of 2022 with the intention of being able to conduct this same survey or one very similar in the future to be able to kind of compare the data to help identify the strengths and challenges that families face throughout Vermont. So once the survey was completed, we hired and trained 14 parent ambassadors from around the state of Vermont. They were trained remotely to share and collect survey responses. The survey was open between August 15th and October 15th. It was promoted on social media by hanging flyers with QR codes to the link of the SurveyMonkey link in popular community spaces. Folks were delivering paper copies to harder to reach communities. Most responses were submitted electronically through SurveyMonkey, though the paper version was available for circumstances in which it was preferable or required for those to have like broadband internet and devices. And all survey responses were anonymous. So the parent ambassadors were supported through by myself and Sarah throughout this whole process. And once the survey was closed, all parents that were hired for this process, as well as all the families that took the survey, were invited to join the Families and Communities Committee in hopes to keep connecting with families throughout the state. And then over the next 6 months, the data team at BBF worked really hard to analyze and summarize all the quantitative and qualitative responses from the survey. And they found 7 reoccurring themes that emerged to inform policy and decision-making. And then within those 7 reoccurring themes, 4 policy considerations were made. Next slide, please. So in the survey, we asked folks their experiences at these 7 locations, and then respondents had the opportunity to pick 3 to go more in depth and provide more feedback and write out answers and quotes. And there were just more specific questions. So here you can see overall responses. Let's see, overall, I want to try and find the number. I think we had 623 responses, if I'm not mistaken. And so there was a range for folks that picked these specific responses. 257 picked Head Start to Early Head Start, and then ranged up to 606 choosing medical care settings. Next slide, please. So from those in-depth responses, as I mentioned, the 7 key themes emerged across services and supports from both the qualitative and quantitative responses. Respondents had different experiences with services and supports, and these themes were not universally experienced. So positive key themes that emerged were relationships with providers, communication, and ease of access. When communicating on, or when commenting on relationships, respondents use the words like friendly, welcoming, exceptional, supportive, knowledgeable, and caring. Respondents particularly appreciated quick response times, providers who listened carefully, and providers who reached out to check in. Closely tied to relationships, communication was highlighted as a key contributor to positive experiences. Effective communication strategies noted by respondents included clear and concise guidance, multiple options to communicate, and spending time together in an established and common understanding between providers and families. Ease of access is both a positive and challenging theme that emerged from the data, and particularly availability of timely services, geographical proximity were highlighted to when respondents were describing a positive experience. Next slide, please. So this leads us to the 4 challenging key themes that emerged. So difficulty navigating the complex early childhood system, difficulty accessing a service or support due to cost or inequity, kindergarten transitions, and difficulty accessing a service or support due to availability. Vermont's early childhood system is complex, as we all know, and often difficult to navigate. So knowing where to look for information, understanding what services and supports are available, difficulties with paperwork and communication, and services having different eligibility requirements came up quite a bit in the responses. Cost or inequity of access were also noted as barriers that families faced. So this could be inaccessible cost of childcare, basic needs such as food, diapers, and formula. While there are free and low cost services and supports, financial assistance for some families, the income eligibility is often different between the services, so it can be hard for folks to understand or know what they may be eligible for. Responses in regard to kindergarten transition showed mixed experiences. So families highlighted concerns such as limited visitation prior to starting, unclear daily routines, lack of communication with classmate families, and limited information shared from the schools. And COVID restrictions were likely a cause for a lot of these. However, there's no universal guidance for practices or expectations, so that can be difficult for folks. And availability was highlighted as a key barrier to access. This could be due to geographical distance, limited or no openings, long wait lists, services that were a mismatch with the residential's needs or desires. And then although mental health services were not one of the 7 services or supports specifically identified in the survey, it was frequently highlighted by respondents in meeting discussions within the Families and Communities Committee. So after hearing the positive and negative or challenging key themes, these are the 4 policy considerations that emerged. And we are today going to focus on the first one, but I will read through all of them. So to elevate and align Vermont's strategies to inform and connect families to resources, review national best practices to reduce administration burden and promote equity of access to necessities such as food, diapers, formula, etc. Support the implementation of clear guidance on the full scope of kindergarten transitions, and pursue integration of mental health services throughout Vermont's early childhood system that encourages ease of access for families with young children. And so 14%, so with this first policy consideration, to elevate and align Vermont's strategies to inform and connect families to resources, 14% of respondents didn't know where to look or who to ask when looking for a new resource. And 13% of respondents were not able to access needed services, supports, or resources for their children and or families. So one quote from a caregiver in Windham County stated, There are so many different ways that services are offered, and it is not clear how they are related. Word of mouth is the primary way that I learn about services and supports, but it is limited to my circles. Various directories are confusing and can provide conflicting information. A bunch of the resources are also far away. Another caregiver in Orleans County said, I feel like information on various services is so scattered and it's hard to find access to everything that's available. And yeah, I think that's going to kick off our conversation about connecting families to resources.
Thank you so much, Jen. I just want to take a minute before we jump in to say, I'm so incredibly proud of our family ambassadors and the family leaders on our Families and Communities Committee. Jen and Sarah did such an incredible job on the needs assessment webinar. If you have not seen it, we can put a link in the chat to the full briefing. It was so incredibly powerful. I just want to very quickly share a quote from a partner that I spoke with yesterday that said, I just want to extend my deepest gratitude and compliments to the team at Building Bright Futures, to the Families and Communities Committee and the parent leads. This is the best parent engagement and parent leadership work Vermont has ever been able to achieve. There was incredible response to the survey, and parents and the committee were so active and true partners at every step of the way. The briefing was phenomenal. Congratulations. So again, my deepest gratitude to the teams that came together to do this work, the amount of engagement, the true partnership that it showed, to actually elevate family voice in a meaningful way and to have such strong participation. Just wanting to say thank you to the teams and congratulations, because it's a really incredible body of work. Okay. So now that you've heard a little bit about the family needs assessment, we wanted to transition, because what you've heard is that one of the challenges that families face is understanding how to navigate the complex system and understanding what resources they have available to them, and how to navigate all of the different complexity within our system. We also have spent quite a bit of time at this Child Outcomes Accountability team over the last couple of years talking about how we as a state are supporting families and identifying what's available to them, making sure they have access to what they are eligible for, and really talking about what equitable access looks like statewide, as well as the range of programs, resources, and support that are available to them. And finally, we have this incredible opportunity under the Preschool Development Grant for the next 3 years as a state to really pursue what quality improvement looks like in this area and think about innovations related to how we are best supporting children and their families in accessing services and resources. So it really felt like the right time for us to bring this group back together around this topic. And to hear from other states about how they are tackling similar challenges. And so today, specifically to hear from one other state and how they've used their preschool development grant funds in combination with state resources to hear about innovations and some lessons learned. So I have had the privilege over the last couple of years to represent Vermont at the Early Childhood Solutions Consortium, which is a national group of partners who are coming together as leaders in each state across the country in the early childhood arena, both within state government, through state advisory council representation, or children's cabinets across the country, and have developed some really strong relationships with some of those partners and colleagues. And Georgia Miartin and 2 members of her team are here today as representatives of that group. So Beth Moore and Karen Oliver from South Carolina, to talk with us about their organization and what their role is in the system in South Carolina, and to present us First 5 South Carolina. So for this next section, I'm going to turn it over to Georgia and her team to do some of that introduction to the body of work. I'm going to ask that folks put questions throughout in the chat. That's something that I'm going to be monitoring. There are going to be points in their presentation where there will be opportunities to ask questions. And then after that, we are going to have a discussion. And Georgia, I'd love for your team to stay on to hear and have some reflection there. So at the end, what I'd like you to be thinking about as they are talking is, what is interesting and intriguing about the work that their team has been able to do under this grant? What are some major lessons learned that Vermont could think about over the next couple of years, and what assets do we have in Vermont to build on over the next 3 years to really think about innovation in this area. So, Georgia, I'll turn it over to you. Thank you so much for being here this morning with your team.
Morgan, it is such a pleasure to be here. And I was thinking about this morning, what a full circle this is. So I don't know if I've shared this story even with our team, but before we jump into the meat of the work, I wanted to give back some thanks to you and to your team, because several years ago, we were for the first time really staffing up and embracing our identity as the state's Early Childhood Advisory Council. We had not had state resources to fund that work. Like Building Bright Futures, we had state resources to implement direct service programs through a network of affiliates across the state, sort of local children's cabinet hubs in every county in the state. That had been the core of our work. But in legislation for about a decade, we had this mandate to also bring together and coordinate a complex early childhood state system, right? So very parallel to be the state's advisory council. And we had just gotten this preschool development grant. It was a 1-year planning grant, kind of zooming back in time. And the reason I said this is a full circle moment today is at that time, we said, well, gosh, like no one even knows that we exist as an early childhood advisory council. We haven't had staff, we haven't had funding. We finally have some resources. We need to put up a website and we need to do it quickly so people know we exist. And I looked around online and was seeing the way that other states communicated about their early childhood advisory councils and found Building Bright Futures before we met on a call, before we met in meetings, before we knew each other. And I randomly picked up the phone and said, you know, your website looks great. Can we copy it? And you all said yes. So if you visit earlychildhoodsc.org, you will notice that it is the Building Bright Futures website with South Carolina photos. So, you know, this is really a full circle moment to be able to sort of pay back some of that learning and sharing that you gave to us at a time when we really needed it. And interesting that what's weaving us together here once again is Preschool Development Grant. So, that was a long-winded intro of part of our connection between our two organizations. Not everyone sees the continuity and connection between South Carolina and Vermont, but it turns out we have a tremendous amount of similarities. And when I want to anchor into those similarities, what I'm thinking about in particular is just listening to your needs assessment. We went through that process back in 2019, and it's been an iterative process. We've continued to survey and listen to families, do focus groups and regional meetings, and we heard precisely what you heard. The top findings were we were exactly where you are. We heard that our system was complicated to interact with. We heard that families didn't know what they were eligible for. And then even if they found out what they were eligible for, there were geographic challenges of knowing where they could sort of use that public benefit or that public resource. A lot of the same challenges. You talked in the needs assessment, you talked about how families were, you know, partly saying like, I need more resources to understand how to better transition my child to kindergarten. That also came out of some of our listening, was wanting to know precisely what skills and knowledge my child should have for kindergarten. That came out again and again. So when we received the 3-year preschool development grant as a state, and it was a collaborative application, again, really similar to where you are. And I do want to actually point this out. So we were one of the implementing partners as the state's Early Childhood Advisory Council. And we were a co-funder. We offered up the state match because we are largely state funded, but we are not the grantee in South Carolina. So our state's Department of Social Services, who's the child care administrator, is the grantee. Even just from that get-go of the sort of shared funding streams and collaborative work as we walked into the 3-year PDG grant, all of that really positioned us well to say, how do we work together across different state agencies, across what seems to be these persistent silos across different eligibility streams, federal, state, and even local, when we were looking at some of those pre-K programs that live in districts in particular. How do we work across that to make a system that puts families at the center and is seamless and smooth and honors people's time and honors their knowledge and honors their self-efficacy, right? And at the same time, provides that additional layering of support that some families want, need, and deserve, right? That sort of navigational support that our childcare resource and referral agencies, or our Help Me Grow agency, or even some of our own First Steps local sort of affiliate organizations, our partnerships that they provide. So that's where we were. I wanted to go all the way back in time and say that before we do a demo for you and introduce our team members. I wanted to go back in time to that moment, because that I think is exactly where you are as a state in a lot of ways. I didn't do much of an intro. I am the state director of South Carolina First Steps, and in that capacity, I also wear the hat, again, similar to you, Morgan, of sort of being the facilitator in legislation for the state's advisory council. With preschool development grant funds, we were able to staff up and hire a program manager to do the daily work of integration in our system. That's across 10 different state agencies and parents and providers. And that program manager is Karen Oliver. So she's here. And then Beth Moore has been our communications director, not only for South Carolina First Steps, but wears sort of a dual hat and also serves as communications director as it relates to this project and all of the ECAC Early Childhood Advisory Council work, really making sure that our design, our language, our development, every step of the way was family centered, family accessible, that we were building a resource that would be enjoyable to use, that would be dignified and honoring, and frankly, that people would want to share, that people would recommend to a friend, right? So this is Beth Moore, Communications Director. And Beth is actually going to jump in and sort of go through and do a demo. She's going to run the slides for us if you want to do a screen share. So this is our answer. This is part of our answer. It's not the full answer, but this is part of our answer as a system. We said, let us begin by using these 3-year preschool development grant dollars to build a single portal into our state system. And let's not necessarily like put a lot of different logos and a lot of different names of federal funding streams or state funding streams. So what you're not going to see when you first come to this homepage of First 5, those 5 years and those 5 domains, we thought about our early childhood system really broadly. What you're not going to see is the words McV, or you're not going to see IDEA Part B or C. You're not going to see the names of agencies, lots of D acronyms, DHHS and DSS and all these departments, because for families, we found that that was just a closed door. That was really challenging. That triggered a lot of concern. This is going to take a long time. It's going to be hard. This site has been co-developed with families, tested all the way through every word, every bit of language. We've engaged families in that as well. So here you are. I'm going to walk through this as if I'm a parent. So here I am, I'm a mom and I have 2 kids, and I live in a county that is has some rural areas and has some urban areas. And I'm not really sure what I'm eligible for. So I'm going to put in my information here, and you can see at the top that it's going to track me through and tell me where I am in this process. And definitely please put in test, Beth, when you do it, because as soon as we start typing in here, we can answer questions about data security, but as soon as we start typing, this creates a bit of information that is stored, not enough information that's stored to create any kind of HIPAA or FERPA compliance challenges. We don't store child level data, but this will be stored just enough that and I'll get to this later, that an organization that provides services for Pamela Cooper, for me, that they could actually reach out to me. So proactively follow up on this lead if it turns out that I'm eligible for that organization's services. So here I am, I'm Pamela, here's my contact information, and I appreciate that you check social media. That is the one way that we are promoting this is through social media, a lot of direct clicks into this portal. So now I'm doing the consent, and that allows the storage of some personal information for referral purposes. So I'm going to put in a birthday for my first child. And if you want to put in, do you want to put in the 1.5-year-old or a rising 4-year-old for this one? So I have both a 1.5-year-old and a rising 4-year-old. So this is my rising 4-year-old. It's summertime. I heard that there's pre-K4 programs. And I'm going to put in that address in Lexington County. Okay, so here we want to take a little bit of time because if there is one section of this that we spent a lot more time on than is maybe clear from just seeing this very simple screen, it's this. So imagine that you have, and I'll share with you that on this portal, there are not only 10 different agencies and entities represented, but across those 10 agencies and entities that span health and early care and education, developmental disabilities and special needs that come into the space of safety and nutritional support and family and parenting programs across all those different domains. Not only is that 10 different agencies, but it turns out to be 44 different programs that families can enroll in. And so those 44 programs all have different eligibility criteria. So rather than looking at and including here every single different wording of eligibility criteria for all those 44 different programs, because a lot of times they have commonalities, we mapped out the eligibility for all of those. We got all of that information from every one of those programs, and then we consolidated them into these big buckets that were family friendly, right? So my child lives in a single parent household. That's going to be on there because at least some of those 44 programs have that as an eligibility criteria. I'm concerned about my child's development. My child is eligible for or enrolled in Medicaid, and that's a ticket into a lot of these public programs. Eligible for or enrolled in SNAP. And one thing too here is if a family, for example, knows that they're eligible for one program. So for example, Medicaid. If they click Medicaid, then if there's a program that you are eligible for, if you're enrolled in WIC, and we know that you are eligible for WIC if you're enrolled in Medicaid, then it does that dot connect behind the scenes digitally for the family, even if that family doesn't click WIC and know that they're eligible for WIC. Okay, so we can keep going. So those are the sort of screener questions. And now we're going to go into income. We intentionally put the income question last because that can turn off families. And this is a parent who has 2 children who's working full-time and making a little over $10 an hour. Okay, that's it. So I'm saying that's it now because that's how long it took, right? That is literally all it takes for a family. This whole portal at this point, you've gone through that. And now what you see is this wide open door into all these different programs that this family is eligible for. So based on that information, this family is eligible for, if you want to go back up for just a second, Beth. So this family is eligible for scholarships. So that's the voucher program, WIC, a nutrition program, Parents as Teachers, which is a home visiting program, Dolly Parton Imagination Library, a literacy program, Countdown to 4K, which is a school transition program, First Steps 4K, which is a pre-K program, full day pre-K program. I point those out because those are programs where the agencies where those programs and services live have raised their hand and chosen to not only be a part of this eligibility screener, but also to be a part of a common application, which is we'll come back to in a minute. So those ones you can actually apply for, even though those live in multiple different agencies in one fell swoop with a pre-fillable application. Not every program is at that point yet for a variety of reasons, some of which are regulatory, some of which are technology, some of which are just like, you know, there are different levels of adoption in technology, and some didn't have the staff time to get on board with that right out the gate, but have already raised their hand and are working toward integration as soon as in the next few weeks. And that common application part of this site only went live on May 1st. So it's super new, not even a month old. The eligibility screener, everything we've shown you until this point has been live for about a year, since February of 2022. So then we scroll down, and these are services, the Head Start, the Early Head Start, Medicaid, some district funded programs and pre-K programs that live in districts, SNAP, disability services, mental health services that require some additional screening and not as much of a sort of online application. These live in a place where you can click on one of those, and we're actually going to do that in just a minute here. And you can connect with it again through this portal, but not with a common application. So Beth, if you want to actually keep, perfect. So we're going to take a different route now. And I do want to pause for just a minute and see if before we go further, because we're going to kind of show 3 different sections, if anyone has questions so far, because we're about to show you some sort of if you look on the right-hand side here, you see check eligibility. Don't do it yet, but check eligibility, view providers, and apply now. So those are sort of the 3 core functions that I'm doing as a parent as I navigate this system. And we've fully completed the check eligibility component of this site at this point. So before we go to view providers, if there are questions, I'm happy to answer them.
So Georgia, one of the questions that came through the chat is whether or not a family would have to go through this for each child and what that process might look like.
Yeah, great question. So if all that you're doing is checking eligibility, then yes, you would have to do that for each child. But if you move from the eligibility screen, which is where I said, like, at that point, we've only checked eligibility for the 4-year-old, and then we move into the next phase, which is the applying on this site, it gives me the opportunity at that moment to add additional children. Now, this is actually I'll say what's motivating some of what's behind that is actually data security issues. So if we were putting in information that tied specific children with their birth dates and their names and was storing that at the eligibility phase, then we would have to have higher levels of legal data sharing agreements with each of those different programs, 44 different programs. And so we prioritized getting this up live, having it available, having the information available to families, and keeping that legal bar pretty low by keeping less data, storing less data. And then when an agency raised their hand and said, yes, I want to actually fully integrate, which is a huge deal, right? Like, I want someone to be able to apply for this program on First Five, have applications pre-fill, and have that, API, the magic of technology, connect into a whole different technology system that lives over at a different state agency. At that point, we knew we were going to have to go pretty deep with legal agreements. We're going to do all of the data sharing and all of the data protections and data security. So that's the phase at which you're putting in all of your actual children. Yeah. So any other questions at this point?
One other question, and this might be something that comes up a little later when you talk about how you as a state are supporting families to get to this point. But the question is really about what supports are in place for family members to actually go through the application. Are there service providers in different sectors that are helping them navigate this? Are you providing tablets? What does that look like? And so again, if that's something you cover a little bit later, that's another question in the chat.
Thank you for asking that. And it's interesting you ask that now. We will come up and talk about that in a little while, but I wanted to share that when we were beginning to plan what First Five would be, and when I say that, I mean, like, before it had a name, before it had a logo, when it was a committee, right, where everything starts, it was a big open tent committee where we did not say, hey, we're going to make this portal, let's invite all the state agencies. What we said instead was, there are some on the ground system navigators who have been doing this important work of helping families navigate our complex early childhood system for decades, and they have to be at that table. So we really cast that broad outreach. We said, if you're an agency that has programs, maybe you have more children that are eligible than are enrolled, and you're sitting on state or federal dollars. Maybe you have families who need your services who aren't accessing them. Maybe you're oversubscribed for your infants and toddlers, but you could use more 4-year-olds, right? So every agency had their perspective on why they were interested in this. And the system navigators as well realized that it was exceedingly frustrating for them to have to go around to all these agencies and constantly update. So, it ended up, this is not the plan, but it ended up that we were sort of designing and co-developing this during COVID in large part. And so that was a time when eligibility for things was changing. Sometimes every quarter there was a change to the eligibility criteria as the feds pushed down different waivers, as the states adapted. And so the system navigating agencies really said, like, this is going to be a useful tool for us to use with families. So they were at the table from the beginning and continue to be a formal part of First Five, even with access on this site. So we'll talk about that more. We'll show that section off in a moment. So I'm going to move on to the view providers. The reason I want to do this is, remember, here we were in scholarships. So scholarships is clicked, but I'm going to go ahead and click all these other things because these are all the childcare and early education providers. And remember what family said, what they said to you and what they said to us was, not only do I not know what these programs are, but I don't know if there's a program like that near me. So this has already used my address in Lexington County to show me what is within a distance radius that you can see on the right-hand side, closest in proximity to me. So this is sorted, you know, that's the furthest, that's the closest. So you can see, and we can just start with the first three. The first one has a kind of funny name, Global Invest at Lexington. That's a business name. And the reason it pulled that way is this is actually pulling as a childcare center. This is a childcare, licensed childcare, from a separate database that our childcare administrator keeps up with, which is the already existing database of every licensed childcare. And that's probably how their license is held, under an investment company called Global Invest, right? And so there it is. That's a childcare provider, and they accept both scholarships, which is our federally funded voucher program, and First Steps 4K, which is a state-funded full-day 4K program. That part of the mixed delivery system is for that to happen in that childcare center, in licensed childcare. And then the one below it, you can see, is a public school. And so that's receiving a different fund source, which, you know, that's kind of code, right? EIA, Education Improvement Act. That's a particular state-funded 4K program that lives at that Lexington Elementary School. And then if you scroll down just a few, you see Lexington Head Start Center. So this is pulling across the spectrum of early care and education programs. And these are all, you know, pre-K 4 programs, or programs that would be applicable to 4-year-olds, because again, you know, this navigated through a person who has a 4-year-old.
Georgia, when I heard you give this presentation the first time, and I can imagine 10 people are about to raise their hand and say, can you tell us, does this actually tell you if there is a slot or what the capacity is?
It does not tell you if there's a slot, because that is not data that lives anywhere in our public system currently. And so, yeah, I mean, I think that for families, that would be incredible. Our childcare administrator is working toward that. That's a vision of theirs. And one of the values of co-creating this in really strong partnership with the Head Start collaboration director and the Head Start grantees. We have 25 different Head Start grantees co-creating it together with the State Department of Education, and also with local school district representatives, not just having those sort of capital city based, you know, government bureaucrats design this, but having the on the ground local folks have a hand in it all the way through. Yes, Mary Lynn, exactly. Who has like been at this table since before this thing had a name, you know, really helping figure out how we were going to make this happen, right? Because we did that, what's been exciting is that as questions came up like, oh, wow, wouldn't it be great if we did that? It actually prompted some of those agencies to go and change things in their own systems. And so it will continue to be an iterative process. When the childcare licensing agency has the ability to track openings, we anticipate and look forward to being able to integrate with that. You know, when the Head Start programs move toward, you know, more global sort of access virtually into their applications, which they're not all there yet, they are excited about, you know, coming on board with the common application. So there's a lot of further development that we haven't yet gotten to do because of where everyone was coming into this portal.
I really appreciate your transparency with our team on this, because the same challenges that we face in being able to understand at any given moment in the state what slots and capacity and childcare and universal pre-K looks like. So thank you.
You know, and part of that is like, let's not, we really held that principle throughout. It was like, let's not make perfect be the enemy of good. And there had been other attempts over the years in our state to do something like this. There were plenty of naysayers. There were folks who said like, this isn't going to work because, you know, the agencies aren't ready, or those applications happen at the district level on a paper form. And if you're applying for this program, EIA, it's pink. And if it's CERDEP, it's blue. And how are you going to replicate a pink and blue form? I mean, like really, really practical reasons why this thing could have failed before it started. And so our principle throughout was like, let's just make it as deep and as good as it can be. In the places where it can go really deep, we'll go really deep. In the places where we're literally like accepting a family and we're having to batch a PDF secure file and mail it over, digitally mail it over, and we can't fully integrate through an API, we'll do that, right? Like we'll meet everyone exactly where they are. And that was a core principle throughout. So while we're still here, one last thing I want to point out before we move on is the phone number is clickable. That sounds so ridiculously basic. We all expect it, but there are a lot of government websites in our own system where you go to a website. You have to, once you get to that website, there's a lot of information. It's unclear who you contact. There are forms to fill out that maybe get to someone. One thing that we heard from families was that process of not knowing what happened with the application or where it went or who to follow up or what number to call. People want a phone number to call where they're going to talk to a human being. And so just having that phone number on there, having it, the majority of our users use this from their phone or a mobile device, for them to be able to click on it and call, at least they can call and say, hey, I'm eligible for a scholarship for your center. Do you have any slots for a 4-year-old? Okay, so we're going to go back now. We're going to leave this and we were looking through the lens of scholarships, but each of those domains, health, I know this has a health working group that's with us today. We could have gone into the health or nutrition or safety or developmental disabilities tab and gone just as deep on any one of those. Okay, so now we're back here and now we're going to shift into the applying, right? So I want to apply for the things I can most easily apply for. And so here we are at that transition screen to our common application. We're going to do this as a guest. You can see that I'm now completing this basic information. The reason I have this basic information is, and this is where I'm putting in my child again, because remember, it didn't store my child. It stored my name. But it didn't store my child. And if you can pause here for just a second before you move forward, Beth, and if you'll change Pamela to test in the name, then that will help us to pull her out. Thank you. Great. So there's my child. I've consented again. And now we're adding that second child. And I don't know how many of you are parents. I am a mom. I have 3 kids. And they're now all school age. They're all in elementary school and I'm doing camp forms. And every single camp form for every single one of my 3 children that I'm filling out for every week of the summer for a different camp asks me this same basic information. And after completing this same basic information for the 15th time, I'm extremely frustrated, right? Well, that is also the experience of families navigating our early childhood state system. Why do I have to keep telling you my name, my email address, my phone number, and the names of my kids? So these are the most basic core components that we know are going to be on every single application. Who are you? So that's why we collect that first. It's now going to pull that information into every application that's a part of the common application. Okay, so now we are in the common application. And here are all the programs that will pre-fill with that information that are geolocated for this child. I told you there were 44 programs. Of those 44 programs, 29 of them are a part of the common application. And this child, based on their age and their geography, is eligible for and in that community is offered this list of programs. First Steps 4K is the pre-K program. Child Care Scholarships is the voucher program. WIC, I think you're all familiar with, that's a federally funded food and nutrition program. And then Lexington County First Steps is a state-funded conduit for home visiting parents as teachers, Dolly Parton Imagination Library, and a school transition program. Now, the reason these show up as separate buttons you can click, and we won't go into them because that would then trigger actually applying. So the reason these are separate is the Lexington County First Steps application is about 2 or 3 pages long. The child care voucher application is 7 pages long. It's a long federal application. The WIC application is really short. It's actually only about a page. And at the end of it, I'm still going to have to go into my local WIC office because I'm going to have an in-person pinprick for my child. And I'm going to, need to have that nutritional counseling, but at least that paperwork process will be done. So because these all have different levels of depth, we front-loaded that child care scholarships one. Many families are interested in that. And when they complete that longer application, the WIC application or the Lexington County First Steps application is going to be almost entirely pre-filled, right? But if I'm a parent and that looks too long to me and I only have 15 minutes, I'm probably going to go ahead and complete the WIC application because it's a lot shorter. Once I do that, if you scroll down to the bottom, it will, I guess it's not showing this because we haven't done any and we're not going to do any because this is a live demo. We don't want it to send to another agency, but once I do that, it will show me that my application is complete. It will give me direct information that each agency has decided about how long it will take for someone to get back with me, what my next steps will be. There is a secure document vault that's available on the site. So once I, take a photo of my Medicaid card or upload my immunizations, whatever these programs need, it will save it. I can connect it with all the applications that it's applicable for. And then it will give me a phone number that I can call as a follow-up if I don't hear back within the set number of days that agency has told us that they'll contact the family. Okay, so there is our demo. We do have some other sections of the site that I'm actually gonna, Beth, if you don't mind, I'm gonna let you, if you want to unmute, not only show off, but also talk through if you're ready to do that. One of them in particular, I think, is the share.
And Georgia, can I add, I'm going to give you two questions as we're trying.
Okay, that's perfect.
So the first one is about data. What are you able to track? What have you been able to look at in terms of trends, impact, accessibility, feedback on the portal, and talk a little bit about data sharing and the feedback loops and CQI, both internally as you're managing and
Yeah, this is a total learning journey for us, right? So the eligibility portal has been live for a year. We're tracking a lot of conversion data at this point. That's our primary metric on eligibility. And when I say conversion data, what I mean is in the world of websites, right? Most people go to a website and then they leave. They don't take action on a website. So obviously our goal is for people to first and foremost come to the site. And not everyone's going to take action because some of the other pages that we have not shown off yet that also were responsive to the needs that families articulated to us are just information. Families said, like, I want to know more about transitioning to kindergarten, or I'd like to understand better, this information about my child's development. So that would not show up as a conversion. That would show up as a visit. So one data point that we've been tracking is how many unique visitors have attended to the site, how many have come to the site, different visitors in that first year. And to give you some context, we have 350,000 children 0 to 5 in the state of South Carolina. In that universe of 350,000 children, 100,000 unique visitors in a 1-year period came to this site. So, almost a third in the first year of launch, going from no knowledge of the site to that many folks visiting it. Of those who visited the site, and Beth, you may know this off the top of your head, what the typical conversion rate is. Is that a data point on like just a regular website?
Not off the top of my head, but I know that we are have a much higher conversion rate than the industry standards. So that's about 1 in every. Well, I don't remember.
I think that the conversion rate for us is that 9 to 10% of the people who visit the site actually fully complete the eligibility screener. So I always like to point out, I told that to a reporter when we were launching the common application. She was like, only 9%. And I was like, yeah, that's kind of amazing, right? Yeah. So just context wise, if you don't know that, I don't remember what the industry standard is, but it's like 1 or 2%. Like it's typical that most people don't take action. So for someone to not only visit the site, but then actually complete that eligibility screener, that's one piece of data that's collected. And then we also look at, of those who completed the eligibility screener, how many of them were actually eligible for at least one program, and that is 79%. So of the people who complete it, it's going to be a yes, which frankly is a big part of the messaging that we've used in our marketing of this. One of the challenges that we needed to overcome was a belief that programs and services were not available in my community, or I was too high income, so I didn't qualify, or our pre-K4 programs were only for children who had developmental delays. These are all sort of myths that exist in the world of families 0 to 5. And so when we were able to say, there are universal programs on here that don't have anything to do with income eligibility. Dolly Parton Imagination Library, all you have to do is live in Lexington County and you're going to have free books mailed to your home every month for your child's early childhood, right? To be able to message to families, there's most likely something here for you. So capturing that data. And then at the agency level, we've been capturing data about who is eligible for which program. So we're able to see what is viewed most, where's the demand from families visiting the site, and then which agencies, as we've launched the application, which ones are getting the most applications. We were able to track and see, on the eligibility screener, which programs were most families eligible for. And then that information is also accessible to the people who are in the eligibility and enrollment seat at each of the agencies, or even providers. So like a Head Start provider, a school district provider can have a secure login and pull what we call a lead, which is a family in their community. They would only see people in their community who are eligible for their services with the name of the person. They wouldn't see the child's information. They would see, this is Pamela Cooper. She has somebody who's eligible for Head Start in Lexington County, and that Lexington County Head Start grantee, if they're under enrolled, they can pick up the phone and call her and say, we see that you're eligible. Would you like to come to our, office and complete a paper application? Can we mail you one? They can do follow-up. And that's also been extremely useful.
Awesome. Thank you so much. There was one other question about a closed loop referral system.
Yeah.
I just want to give you a quick time check. You have about 10 to 15 more minutes, and then we'll move into formal discussion, but just wanting to see whether or not the system itself can tell when and how applications are moving, how long it takes, even though you're introducing it to the family to say, here's about what you should expect.
Right.
Back end. Yep.
Yeah. So some yes, and some no. And part of that has to do with, again, the comfort level, willingness, and technical abilities of that agency. So for example, with First Steps 4K, that's another part of the same organization where I sit, right? So we are already, as an organization, very connected. So we are able to see and track what families come from First 5 into the First Steps 4K application system. So other families may come directly into First Steps 4K from a direct application, or they come through First 5. So those first 5 families are coded. And then based on how they're coded, we're able to track that and see how they sort of matriculate through that process of application, and if they eventually get connected to a program and enroll and show up on day 1, right? We are able to do that technically, but not every agency has wanted to do that. Some agencies, I think one agency wanted to do that, but didn't want to share that back with us as the Early Childhood Advisory Council at this time. And I say that really casually and comfortably because frankly, our governance structure is very much a shared leadership structure. The Early Childhood Advisory Council is a facilitator of collaboration. We are not a top-down mandate. We have almost no legislative authority. This was not accomplished. As much as the legislature here in the state was talking about the need for breaking down silos, the legislature did not tell these 10 agencies to do this. We just went and did this, right? And so that is also part of the sort of politics, the little p politics of navigating, deciding to do something voluntarily together, and really setting the table where we honor and value everyone's comfort level, right? So I think we should move on now to a question that came earlier, because it's really important. Beth, if you want to go to the need more help tab. So this is where for that family, they've gone through the screener, or maybe they've just clicked around. If you hover over services and don't click on services, up at the top navigation, go up to the top navigation where it says services. If you hover, so you can see those different types of services, and don't click on any, but maybe a family went that route and they just kind of read about all these services and it looked good, but they were concerned because they've had some negative experiences, or maybe they're in a unique situation, or, they want someone to, help them to navigate them, right? The people we call navigators. Then they go to that need more help button, which is where we are. So these are partners who have been a part of the development, the local First Steps infrastructure, those system navigators in every county, the childcare resource and referral. It's really clear like how that navigational partner can help. And I believe you have a really strong Help Me Grow system from what Morgan has said in Vermont. So I want to talk a little bit about the role of Help Me Grow South Carolina. So Help Me Grow South Carolina in our state really is targeted at helping families, not only complete the ASQ and understand their child's development, but connect with developmental resources. Unfortunately, as an infrastructure in our state, it's available, but it is not fully funded. So they're always having to do additional fundraising beyond the dollars that they have. As a result, the idea that they would be able to be the single, that any of these, that First Steps, local partnerships, or Help Me Grow, any of these could be sort of a single entry point into our system was just financially not feasible, right? So imagine being an agency who says like, we want to hang up our shingle and then 100,000 people show up in the first year, right? A website can do that. But ultimately, Help Me Grow is that navigational resource for the family who has concerns. And so we see them as a core part of that, that sort of navigational infrastructure for families. Additionally, there's the ability to do pop-ups on the site. We won't show you that, but for example, if I clicked that I had a child who was rising into kindergarten, it would give me, it's not literally a pop-up because those are a little ugly. But it populates with a separate link that says, we see your child is almost ready for kindergarten. Here's some kindergarten resources. We have the ability to do that for Help Me Grow, to be able to say, we see that you click the button that says you have some concerns about your child's development. Here's this great resource through Help Me Grow. At this point, that feature they haven't opted in to do that. I think just because of resource challenges, to be able to be responsive to folks who might come in that way, but that is available, right? That is an available technology feature that a site like this can offer. What other questions? Or Beth, was there anything you were wanting to show in particular?
Sure. Georgia mentioned when we were first looking at the eligibility screener that most of our families are finding First Five through social media. And that's because we've been investing in paid digital advertising to create sort of immediate visibility and to drive a broad audience to the website over the past year and a half. So we are also, while we're doing that, we're also working to build search engine optimization to create long-term sustainability for the site, so that we've been building in really quality content, especially through this section called Learn. So we are posting regularly to the blog here with topics that would be relevant to families. We also have a list of resources, so families can see in one place just all of the resources that might be available to them, especially through the early childhood state system. Additionally, we realize that word of mouth is really the most effective way of reaching families and building trust and credibility. So we are sending our partners, system navigators, direct service providers to a section called Share. And this is actually not at the top, so it's not something that families might make their way to, but we can easily share the link that is visible here. And this is where our partners and anyone else who's interested in sharing First Five with families can find printable materials. We're developing materials right now in both English and Spanish. We have a social media toolkit with graphics that are really easy to pull and share, sample social media messages, and then logos. And we're also developing other things like clickable badges that people can add to their websites, so that we're building those backlinks across South Carolina that are going to drive families back to the site. You can see here that there's a print material order form where people can easily request materials and we can get those out to them.
Beth, if you can just really briefly go back to the Learn page.
Sure.
There's a very robust section that was preschool development grant funded in large, I mean, this whole thing was, but in large part, we really did some additional investment, some additional work around building resources for kindergarten transition. That came directly out of our needs assessment. I heard that loud and clear in your needs assessment as well. And there was such a demand for that, that there was actually a whole separate site and toolkit and resources that Beth took the lead on. Beth, do you want to just quickly click on the Count in a Kindergarten
Sure.
site, because that's a place with lots of additional resources that are specific to that. This was also all, preschool development grant funded. So I know this demo is not about that, but if there's a different working group who's, specifically going to tackle some of the transition to kindergarten work, we're also happy just to, send over links to you. We're going to share out for this and some of the other resources we've created.
That's awesome. Thank you.
Yeah.
So I'd love to actually open it up for questions. If you want to pull down your screen share, I'd love to just, hear some reflections from our team in the state. What are some of the things that you, first, if there are more questions, by all means, ask away. But I'd also love to hear, what are you finding most exciting or intriguing about the work that the South Carolina team has done? I'm getting text messages from folks, so I'd also like to have you share it here. What are you most excited about? What are you thinking? What questions do you have?
I can jump in. I hear a lot from parents about, again, just the information that I shared earlier, but just conversations from families in the Families and Communities Committee about where to go for resources, what folks are eligible for. A resource like this would do wonders for our state. And it's really exciting to see that North Carolina has it and that you got so many views in the first year. That's incredible. And it's really exciting. Thank you for sharing this.
One of the things I thought was really exciting was the way when you, there are many things, but just one example is what you described, Georgia, about filling out one application and then it pre-populates the other ones. I hear from a lot of families that would be, so welcome, and you found a way to do it.
Thanks, Anne. It's also really great to see you. I wanted to just say something. There was something in the chat about where is it? Just how daunting it seems to get buy-in from partners to move forward with such a large body of work. And I know we're here today, like showing off the end result, but it was hard work. It continues to be hard work. And there's someone who is not in this call today because she's out there continuing to do the hard work. Rachel Hatton Moore. This project didn't happen without her. Excuse me. So to have a person on our staff who is a dedicated project manager to, do the follow-ups, sometimes it was a matter of saying like, we're happy to come do a demo or share with you this vision. And it might've been like 4 or 5 attempts to even get a meeting scheduled with the right partners there, only for the answer to be like, well, no, we're not going to be a part of the common application. And we're not even sure this is needed. And then, maybe at the 11th hour, 6 months later than we wanted, for that group to come on and be a part of the eligibility screener, right? Sometimes that was the journey. But part of it was just persisting forward with those who were bought in. And there were some, I think, having a core group of early champions who stood together. I want to name some agencies because I always think that's valuing to do, but to have our childcare administrator, to have our WIC agency, to have like 3 different agencies and First Steps, to have 3 agencies who said like, we're doing this. We'd love you to be a part, but we're doing this, right? To have that momentum that was pre-built in from the start really helped those who, maybe took a little bit longer or were just a more diffuse system. It wasn't always resistance. Like Head Start, it's a diffuse system, right? It's not the same when you're, that was getting 25 different entities on board, not one. So sometimes it was just a structure difference, but yeah. it is long work. It's hard work, but very worth it for families.
So one of the major themes that I'm hearing from your team, Georgia, is the importance of that collaboration, the partnership, the trust that you built to be able to do this, right? And that is something that we absolutely feel in the state of Vermont, where all of our work is really built on the relationships and being able to move forward together. I'm wondering if you could name between your team, like what were the top 3 biggest challenges you faced in doing something like this? Obviously the partnership and the cultivation, but what were the top 3 things that could have broken at this as you went through this process?
Yeah, that's a great question. And Karen and Beth, like, feel free to jump in too. I'll say from my perspective, I'll start with one that's really more than one. So sometimes the no's were unclear, right? So sometimes the no sounded like, well, we don't have the technology bandwidth to have a meeting with our tech person and your tech person. But really, it wasn't about technology. So we might have waited for 4 months for that tech person to be ready, only to find out that it was not a tech issue. It was a person up in legal who said, like, this will never fly. And so I think one of the biggest challenges for us was accepting, once we kind of mapped out and said, you know, there are going to be regulatory, legal, no folks and challenges in regulatory and legal. There are going to be technology challenges. And there are going to be program bandwidth challenges. I think once we were able to say, those are all valid, and to really ask for honesty from our partners about, like, what's really behind your no, because if you share with us what's really behind your no, maybe it's solvable and maybe it's not solvable right now. You know, in one situation that I can think of, there was a yes to the eligibility screener, a yes to resources, a yes to pulling leads, and a no to the common application, because the common application makes it really easy and fast for people to start the application process. And for their program, they were so inundated with families, and a federal clock was ticking on them every time an application came in, that if they got twice as many applications because it was really easy for families, they would have been so far, they knew they would have been so far out of compliance with the feds that would have ultimately cost them money and resources to help families. And, you know, it took an extremely long time to get that answer. But once that was the answer, we knew how to proceed, right? So I would say just that was really, you know, there was some real sticky stuff there. Karen, Beth, anything you would add?
I wanted to share that we took something else for a test drive before we built First Five, and that was Palmetto Pre-K, where we brought together Head Start, the Department of Education, our child care scholarship folks, and First Steps to develop that trust, do that work. You saw part of that at the beginning of the demonstration, where you were finding the providers that were geographically located. Building that first, was proof of concept. It was easier to get done, and it allowed us to think through some of the thornier parts for First Five. So I just wanted to share that we didn't dream it and build it immediately. It was a pretty thoughtful, it always is a thoughtful process, but I encourage you to look at our Palmetto Pre-K website as well, because it is a place where you might find it's a great start. And then I also saw in the chat that somebody had mentioned the family centeredness of this project. And I wanted to highlight that, as Georgia said, we really were involving our Family Voice Council and beta testing throughout with families. And we also did a disability audit so that we could, to the degree that we can, this website is accessible to folks who have disabilities. So we're doing what we can to make this a self-navigable tool for the majority of folks who can, on their own time, when it's convenient for them, find and apply for the resources that they might want, need, or deserve. So, thanks.
Thank you, Karen. Some just incredible lessons learned. So again, I really appreciate your team's transparency as you've navigated the process, because it is amazing to have you come and share this beautiful website and this portal that does some incredible things for kids and families, and how to go from the vision to where you are now is really complicated and takes a long time, and it really takes some partnership. So I appreciate your transparency there. Go ahead, Janet.
Thanks, and thank you all. It's just amazing work, and it's so exciting to have you here and such a large Vermont audience taking it all in. I really appreciate what Karen just shared, because that was what I was wondering. Would it be easier to start like some sort of common eligibility process within one state agency, or within, multiple programs in our Department of Children and Families or in our health department? Start there and then build out and include more partners. And it sounds like that's how you kind of had a template or a beginning to which to expand on. That's my comment. So I don't know where we would start in Vermont, but I think that even if we had started with 2 state entities under AHS potentially to build that collaboration and demonstrate how it works for a handful of programs, then we could really get some momentum.
Yeah, it was absolutely helpful, Georgia, Karen, and Beth, to hear you say, we talked with folks, some we talked to right away and they were on board because they saw the value and they were ready for whatever reason, right? And so it sounds like you started with the folks who were ready and committed, and then made the case for those. And that one of the things I really appreciated you saying is we met them where they were. Some of our agencies had full capacity to be able to dive in and go right for the common application, and some just had the ability to put their information on the website, right? Here's what our program is. And some said, okay, yes, we'll be a part of the screener and have that information. And that it really is this tiered and iterative process that is going to change over time based on the needs, which I really appreciate. Other reflections from your team, Georgia?
Yeah, I just thank you for saying that. And I really can't underscore enough also how important it is to celebrate every win along the way. And we did a lot of that. We did a lot of celebrating. It was a really hard time for all of us. We were all working our tails off from home, many of us with our children during COVID, while we were doing this thing that a lot of folks had said we couldn't do. So that was also part of the context. I remember one moment where there was a woman within the state Department of Education, and she had been really bought in just personally on this project. She leads our early childhood programs within the State Department. We have 79 different school districts. We have a very locally controlled school system here in the state of South Carolina. And, she saw the beauty and vision of this. She'd been part of the Palmetto Pre-K team. The reason I wanted to tell this story is just to piggyback on what you're saying, Morgan. When we think about what the A was, when we think A to Z, we had been in a place where, as a state, if you were on a mobile app, I shared with you that I had young children myself at this point. I had 2 4-year-olds and a 5-year-old who were all home doing e-learning. And I remember going to the State Department's website, looking at their 4K programs on my phone, like many families were. And it was a blank page, was their list of 4K programs, because it was not left justified. So you had to know to go there. Then you had to scroll over because that page on their website was not formatted correctly. And then what you got was a list of 79 different school district websites that were not even mapped to their early childhood page. And then you would go to that website and you'd spend a very long time looking for their early childhood page to click on it. And it was July and all the school districts were closed, and you would call a phone number and no one would answer. We went from that in 2020 to not only can I find out what I'm eligible for, but I can find out where it is and I can apply for many of these programs. And I remember, Wendy, a phone call with her. We were both at home, like having that phone call about like, we did this, we made this happen. But part of that is we had developers who were not a big fancy tech company. They were based locally. They were co-designing this, and they were in that exploratory meeting. And so when they were pointing out to the State Department, like, hey, you know, we'd be happy to share with you some suggestions about how to make this better. So they were also helping them improve. So now that website on the State Department's portal doesn't look that way anymore. And that is also sort of a side outcome of this project. It was all growing and learning and celebrating together.
And I'll add that the celebrations were not only for the benefit of our own morale, but a challenge that we've experienced is really building buy-in and shared ownership in this portal. You know, here at First Steps, we had a relatively small team working to build not only a portal, but a brand that was not our own. So even our own staff here at First Steps didn't necessarily automatically feel bought in and like they were a part of the project. So the celebrations, the constant opportunities to provide feedback and input, all of that has been strategic in helping other people feel like they're really a part of this.
Thank you, Beth. One of the things that Vermont has struggled with and will continue to struggle with is the technological infrastructure. On the data front, on the just on the very basic level of what our tech infrastructure looks like. And so I see a question in the chat about how you bring that necessary tech and tech expertise to your team. I think a bigger question is, where does this live? Is this, and who is leading this in your state, and how did you decide? Because this is such a collaborative effort. So what does that look like? Who is managing this body of work? And can you talk a little bit about the tech side of that?
Yeah, so you asked before what could have killed this before it even started, and tech and data security issues could have killed this before it ever got out the gate. In our state, we are in a very red state that is very concerned about data privacy and not tracking kids. Like this is a huge political issue in our state context. And frankly, it's a real issue for a lot of families too. This is not just a political issue. We heard this from all ends of the spectrum. And so one non-negotiable for us from day one was that this needed to be fully custom built and owned by government, because government has a lot of, meaning like our state government has a lot of oversight, has a lot of accountability, has a lot of rules and regulations that are already watching it, that made the all of us and our own sort of folks that we were accountable to, whether that was the state legislature or a federal funder, feel more comfortable. There are some platforms that other states have used for different tech projects. We talked to Colorado when we were developing this, and they had used a proprietary vendor that initially built their system 10 years ago. And they said it was costly, right? So not only was it an external sort of vendor platform, as they wanted to make changes or add additional programs, each of those adds a new lead, that was how those companies oftentimes make money. And so we said, we're going to put out an RFP. We're going to go solicit quotes for a custom build. And to answer your question on ownership, so it was a tech firm here that built us, a web app developer. It was also more affordable to do it that way for us. And then the other piece I would say, we have a built-in governance structure, which I think you have as very parallel as the state's Early Childhood Advisory Council, where the directors under law, the directors of each of those early childhood serving agencies, not their designees, sit on that board of trustees to govern the integrated early childhood system work. And so that was the governance structure, and the owner, if you will, of this website, of this portal, and of its data is South Carolina First Steps, because we are the legal operator of the state's Early Childhood Advisory Council. When Beth was talking about identity, frankly, there were agencies that were like, we don't want to share all of our info with South Carolina First Steps. You know, we even went to our lawyers and said, can this agreement say this is an agreement between Early Childhood Advisory Council and, Head Start? And our lawyer said, no, because you are legally South Carolina First Steps. facilitating the work of your state's early childhood advisory council. So identity wise, that reared its head sometimes throughout. And that's part of why we had to be so intentional about making sure that we never used data that we got about other agencies for any purposes for South Carolina First Steps, the direct service provider, and that we truly wore that, put the boundaries around the early childhood advisory council role very firmly. So Karen Oliver is dedicated only for the early childhood advisory council. Rachel Hatton-Moore, the staff member who led this project, is an early childhood advisory council only employee, fully funded by the preschool development grant. And that was really important too.
Thank you. That's incredibly helpful. And the way that you're talking about that governance infrastructure does remind me, for folks on our team, when we're thinking about that stepped visual at the Building Bright Futures network level, it's the ECICT team. It's the agency leaders who are sitting on the State Advisory Council, almost like Vermont's Children's Cabinet. That is the parallel to the work that Georgia was just mentioning. All right, so we have 3 minutes left in this meeting. So I just wanted to pause and say, first, a huge thank you, Georgia, to you and to your team, and also celebrate alongside you the incredible body of work that you all tackled. It is so inspiring and exciting. And to say to the Vermont team, I didn't bring Georgia's team here to say, now we have to do all of this. I brought them here to say, what assets does Vermont have? Look at this incredible model. How do we think about what is the next step for Vermont in our trajectory to really think about how we get kids access and families access and let people know about what is available? And wanted to just say again, thank you to the people who are on the call today from all across the state of Vermont, from all of our different departments, divisions, agencies, private partners, direct service providers. It is an incredible group of people who are able to be here to hear about this and now think critically about this. We have the next 3 years of a preschool development grant. We have grant funding that can go out to communities. We have the flexibility to say, what are the needs of our state and how are we addressing them over the course of the next 3 years? So I want you to be thinking critically about this. I want you to think about what types of recommendations we as an advisory body would make based on the data that we've heard today, based on what might be possible and the vision we have for our system. So we have 1 minute left. And I know I didn't leave you any time to do any sorts of updates, but would say I'd love to have a follow-up discussion with this group about this body of work, about what your reflections are. And I'm really excited about the future of this work. So again, thank you, Georgia and team. Thank you all for being here today. We'll see you all soon.
Thank you all.
Thank you all.